Hello everyone, good afternoon and welcome to another segment of Doctors Go Live on Columbia Asia Facebook. It's very good to see all of you here today, although it's only one way, but we can be interactive because the topic that we have today, which is about handling back pain, you can ask your questions and our special guest today will be able to answer your questions on the spot. Okay, with that, I would like to introduce from Columbia Asia Hospital Setapak, Mr. Chandrasegar Gobi, who is the physiotherapist from Setapak, and he will be talking to us about, excuse me, what's happening to my voice? He will be talking to us about reducing back pain, right, sorry, Mr. Segar.
Yes, ma'am.
Okay.
Hi,
Hi. Okay, I'm just going to give a very quick intro, okay? Having back pain can withhold you from many daily activities, including basic movements such as walking and climbing the stairs. I think there have been a lot of complaints from a lot of people. Of course, people in their 40s, 50s, but now back pain can also happen to the younger generation. But fortunately, there are exercises that you can do at home in order to help reduce the pain. So this is where you come in lah, Segar. Okay. Again, any questions that you might have, please leave them in the comment section below, and Mr. Segar will gladly answer those questions. Betul tak, Mr. Segar?
Yes, ma'am. Yes, correct.
Okay, all right. Based on your experience at Columbia Asia as a physiotherapist, what type of back pain is common from the cases that you've seen? Would it be like more lower back pain or upper back pain?
So, based on my experience, I've encountered quite a lot of people here. Those who are working here are very much desk bound. They're high-tech people, so they tend to have a lot of neck pain and back pain, and of course, the mid back. I should include that also. But majority of them, they do have this mechanical back pain where they get it when they have wrong posture. So due to the wrong posture, it leads to the back pain. So they will do. These people also do come over to our place for treatment.
I see. Is it possible to conduct your own physio at home for back pain?
Madam Shakina, actually back pain, when I talk about back pain, there are few varieties of back pain. So when we see back pain, it's very generalized. So if specifically, if I talk about non-specific, non-diagnostic type of back pain, then it is advisable you can just treat it at home with your home remedy by giving ice and so on. There are certain stretches which you have to do and it will go off. Somehow it will go off within 3 to 4 days. But if you have some type of back pain which is known as various spinal condition back pain, that one you really have to come and meet a doctor, rule out the diagnosis, and then the doctor will send to physio and we will do the best for the patient. So in this type of cases, it differs.
Okay, all right. So if you can advise when anyone starts feeling the back pain in the back, what is the first thing that they should do? Like, how would they know what kind of back pain they have? So they need to go to the hospital, or they can just, have a remedy done at home.
So it all depends on the mood of injury and then the duration of the injury and how it happened. So let's say if a person abnormally lifted up some heavy loads from the floor, he might have some back pain, back strain we call it. This will come under non-specific back pain, and it will last about 3 days, like how I told you. And this can be corrected through certain exercises, movement by which stretches and a little bit of pain relief, sometimes medicines, and also ice pack compression. It will go off. But if the person has some spinal issues, then it is absolutely they should not treat themselves. They must come to hospital and meet an orthopedician.
Okay, but like you were saying just now, it's a spinal issue, but how do you know? Would someone who has serious back pain suddenly be unable to walk? I mean, like at which point of that pain in the back should you not panic lah? But at which point does it become really serious that you have to go to the hospital immediately?
Correct. Before I go deeper into this question, I would like to give you some elaboration about back pain. So every human, all of us, we have very good formation of muscle in the front of your body and that around your tummy, and then you have at the back of your at the back of you. So these muscles are formed to hold your spine in place. But what happens? See, most of us, we are very sedentary, we go to work, we don't exercise and so on, and then those who overwork also, they will have these issues. So this muscle will it will actually lose the property of it, the strength. So what happened? The base of the spine, the spine is not aligned well. So when the spine is not aligned well with the improper technique of your posture, then the flexibility of the spine will be altered. So due to that, there will be overacting of the muscle at the back. So imagine if I bend down, if I don't have a good core, what happened? The muscle will overact. So when the muscle overact, then the muscle will overproduce, and then it has to contract more to hold the body weight. So this will cause a strain to the muscle. So now, as I told you earlier, madam, back pain can be classified into three. The first one is non-specific. This is what I'm talking about and we are discussing about, which it will cause you a little bit of soreness and ache at the back. So when you have that, it is okay. But if the same pain, it multiplies into worse type of pain, which thrombing, shooting, and then radiating to your lower leg, that is considered alarming, that's when you have to go and meet a doctor to rule out. Okay. The real investigation has to be done in order for you to rule out what is the cause of the pain. Sometimes it could be some spinal bulge, disc bulge can actually compress the nerve, and then this will cause the pain. So this we need good professional supervision on this matter. The third type is a trauma type. So let's say a person who drives motorbike and then all of a sudden he falls. So this comes under motor vehicle accident, and when he's seated, there will be a lot of compression on the spine, and that will also cause back pain. So these are the things we have to know in general. So the discussion today is basically about back pain, which is known as non-specific. I'm keep on repeating this because I don't want people to wrongly idealize whatever I'm saying and then try to do at home. So this will cause to an issue later. So when non-specific pain occurs, it can be treated at home. So the whole idea which I want to implement to you all. Next, talking about this non-specific, cause and risk factor also plays a very important role in this type of issues. Like age really matters. Like age, those who are aging, during the aging process, there will be a little bit of muscle elasticity reduction, meaning your muscle, they won't be strong enough like how you were young. So there will be a slight decrease in that strength. At the same time, your bone strength and density also will be reduced. So when there's a reduction, when there is no permeability or there's no flexibility in your spine, they can't do the work properly. They cannot hold your body in place. So that's when later on you will have some disc bulge, compression to the nerve, and wherever you compress, it radiates towards the nerve. All that area you will have the issue. So this is quite alarming cases. And the second type of cause and risk factor, which is also known as physical strenuous work. Nowadays, a lot of people, they do labor work, and certain group of people, they actually desk bound throughout their life, throughout their working life. They are totally rigid in their posture. They don't know how to take care of their posture. And then the furnitures in the companies, it's not good. It is not advised according to ergonomically for Asians. Those who are tall is then to sit in a short chair, and then they will have mid back pain and a low back pain. All this eventually will lead to some problem. So ergonomic and improper posture will lead to back pain also. So that's why it comes under risk factor. Third one is actually overstretching or exercising. So nowadays we have, after PKP, everyone is like little bit, they have put on a little bit, so they want to shade off whatever they gain. So what will happen? They will tend to over exercise. They do all sort of exercises without a proper coaching. So this will lead to too much of exertion to the muscle, and then it causes back strain. So prolonged sitting and standing also another impact on this. Those workers who they have to work for 8 hours just by standing, the operator workers, they will have this back pain. Very, very common. And those who are desk-bound, seated, when they are not aware, they are not educated well, they tend to slouch, sit like this, for very, very long hours, and then it will cause, the alteration will cause muscle back strain. So all this, it's if it falls under the unspecific back pain, then it is good. But what happens if this leads to spinal condition? So, so these are the things everyone has to be very aware of. So when we have when a person has back pain or back strain, what happens? He will have these certain signs and symptoms. Those are like muscle ache. They will feel sore at the back. Every time when they sit, they will sit one time, no more normal, and then try to stand. Also, it's painful. So when a person has that type of pain that comes under ache and sore, that is considered to be a back pain. But again, this has to be ruled out by an orthopedician and medical professional. Right? And then mobility. Movement of a person will be limited, and plus the trunk movement also will be limited. They can't bend. They cannot do the activities, the daily activities. That will stop them from doing this. So this has to be really rectified immediately. Right? Next is difficult to stand straight and walk. The moment you know this, immediately please do something for your back. Don't just keep quiet because this will lead to some other issues. So, madam, so these are the signs and symptoms about back pain. Next is contributing factor. Inappropriate posture. Posture is very important, madam. When we don't have a proper posture, when we don't educate our own self, when we don't have a proper awareness about our posture, somehow those who are not aware, they will get this back pain. Not only back, the movement starts, then the neck also starts because they are all interconnected. So the spine has to be in a S proper shape. So then the muscle will work properly. You will have a good distribution of weight evenly in your body.
I see. Yeah. Okay, all right. On that note, just wonder whether, some people when they have back pain and then they do their own massage, or they get their children or their wives to massage their backs, is that advisable?
Yeah, through my experience, madam, absolutely do not massage. You know why? You don't know what is the structure is involved. So the back is too complex. So if a person accidentally they go and massage, that's going to cause more pain and it will never resolve. So before all this drama episode takes place, it's better not to touch. If you think it's very alarming, after 3 days you still have pain, kindly go to an orthopedician, get it done, all the tests, whatever you need. The orthopedician will do certain special tests, and then that will actually have to rule out what is exactly the issue is. Then it's rather to be treated the issue rather than provoking more.
Yeah. And I was going to ask something about participating in sports. That one, as you were mentioning much earlier just now, if you have a back pain that recovers in 3 days, so that's okay, or it depends on what the doctor says.
Yeah. So, madam, again, when you have back pain, it's always advisable. Please rest. Make the pain to reduce drastically. If it doesn't reduce, then there is nothing for you to go and see a doctor. But let's say it's just a normal unspecified back pain, it will somehow resolve. So during that stage, it is okay for you to do a gentle sport. A gentle sport, again, I'm saying. So do not go and exaggerate yourself and then provoke back, because the muscle has to really rejoice back. They have to come. They must get back the strength. They have to heal themselves. Then only it is okay for you to utilize the muscle properly and they will work properly. Otherwise, you're going to overstrain the muscle and going to impact the muscle more, and then it's going to lead to something else.
Yeah. So perhaps this is why, when people go to the gym, which is the thing that is trendy today is weight lifting, when they do strength training, but they're advised to not do it every day because takut the muscle stretch or tear or something like that. So perhaps this is also the same case as you were mentioning just now.
Exactly, madam. That's a very good point. You nailed it. A lot of people are going to gym just because they have equipment. They're just going in, doing something on themselves. They are getting YouTube and then mastering some certain things without a proper teaching. it is always advisable for you to get a coach, get a fitness trainer, let the person teach you, because by doing a lot of this type of method without knowingly, without a proper knowledge on equipment knowledge, this will actually lead a lot of cases. And I've seen many cases like this. These are normally for youngsters. A lot of youngsters have this problem. They have the motivation to go and work out, to do something with their body, and then to bring out the best in them. But when they don't have a proper coach, all this falls down. It leads to something. Yeah.
Even among young people.
Yes, madam. A lot of people. Yeah.
From your experience at your physio center at Columbia Asia Setapak, do you see any patients as young as how old when they come in with back pain?
Back pain, I've seen 15 years old. 15
years old.
Very young. And they
have sports, from doing aggressive sports.
Yeah.
And weightlifting and all that.
Some are due to trauma, motor vehicle accident. Some are through and some are through sports.
I see.
So my word is that everyone has to be educated in certain things, then they have to indulge. Otherwise, get someone who really can actually educate the person and get it done.
Yeah. Like a physical trainer.
Exactly.
Professional. What are the movements that one should not do when they have back pain or when they are prone to getting back pain? For example, just now you said posture is one thing. Yeah. And then about lifting things the correct way.
Exactly.
Right. What else should they not do? What movements are specifically memang detrimental to your back?
Okay, detrimental is when you additionally load something to the spine. Externally, you bring something and then you load. That will cause a lot of issues at the back. So, example like what you say, when you lift weight, certain weights, there are certain formulas for you to lift weight according to your body. It is not immediately going to carry about 50 kilo and then get it done, do your workout, then it will damage the spine at the back. So, detrimental, like what you say, I would say sudden abrupt movement while when you're dealing with weight should be avoided. And then all of a sudden bending and taking things without proper lifting technique, that will also cause the pain. So it is very crucial for everyone to know the exact method to lift things from the floor, lifting your kids, lifting your groceries. All this is very important nowadays.
Okay. Perhaps if you don't mind, later you can show a step-by-step, a short demonstration. You are going to show us a demonstration about how to handle back pain, right?
Yes, madam. So, can I start with the demo?
Yeah, sure. Whenever you're ready. Okay. Is there anything else? Because I would like to just address the questions first. My questions, because later we can have questions from the viewers. But if there is nothing else to add, maybe you can already start your demonstration.
Okay, there are a few things I've prepared in my mind actually for the talk. Okay. So will you permit me to proceed with it?
Yeah.
Okay. So back again to that issue with back pain.
Right.
Posture is very important. Number 2, lifting mechanism is very important. Number 3, your back hair is very important. You really have to jaga your back. Otherwise, it's going to lead a lot. Okay. So there are, I strongly believe, prevention is always better than cure. It's rather for you to exercise earlier rather than you exercise later after you already have something there. So before you provoke something, it's better for you to just work out on the prevention method. So when we talk about prevention, you really have to listen and then lend your ears. There are certain ways, certain examples where you can actually implement in your daily life to prevent all this from happening. Okay? The first one, everyone, all the viewers, kindly exercise regularly. It is recommended 3 days in a week. And you try to do your exercises 30 minutes to 45 minutes. This is the recommended period hours. So, what type of exercises to do? That will be another question, right? So, you must do a low impact aerobic exercise. Example, go for a walk, brisk walk, and then you can do swimming. So these 2 exercises is very, very fundamental exercises which you really have to do. So the more you walk, you build the muscles. You will have a good muscle. because it involves abdomen and your back muscle. You agree, Madam Sakina?
Yes, yes, definitely, of course, yeah.
Correct. So,
And I think maybe age-appropriate exercises are also good, lah, because sometimes, you know, as age comes, and then there are certain exercises that you should not do, I suppose, but you challenge yourself. High-intensity exercises. Of course, you're the expert, lah, because, you know, at 50, 55, but you still want to do dancing. Do you know what I mean?
yeah, I got that.
Yeah, yeah. So there are certain movements, yoga,
Totally
there
agree
are certain
with
movements
you.
that are quite painful.
So the more you age, there are certain things you cannot do. You have to limit yourself. You can't be like lifting things when you're aged. So all this matters. So the first thing is exercise regular. It's a low impact aerobic exercises like walking and swimming. And then the second one is you must strengthen your abdominal muscle and your back muscle. So this comes under core strengthening. So when I talk about core is basically your front muscle and your back. So they have to be in power to hold the spine throughout your life. So
I think when you're talking about core strengthening, when you do planks, that's one of
yeah,
a recommended exercise to strengthen your core. Is that right?
yeah, but it also depends on individual. I can't immediately say because I haven't seen my client. So I have to be safe with my word.
Okay, of course.
Plank is also one of the core exercise, but you have to be careful when you do that. Please consult the nearest professional, whoever next to you.
Yeah.
Just have a word with them. They will share with you. Okay?
Good
So
advice. Good.
core conditioning exercise is one of the very most important thing which you really have to do, and that will actually help to hold your spine in place and give you the strength to do your daily activities. That's number 2. Number 3 is you have to
Sorry?
you have to manage your stress level. Stress level nowadays, a lot of people are very much stressed. So this stress level, first the stress will start and then it will fall into depression. So throughout the stage, what happened, you won't be very aware of yourself. You tend to lack in many things. And that's when your posture will show a lot of issues in you. So when a person is stressed and then he's depressed, his posture will somehow slouch. He will round his shoulder and he will be totally off from alignment. So when this is prolonged, and this is also will lead to back pain. So stress also one of the factors for me to add on here.
Oh, I see. Oh, that's very interesting. I didn't know. I mean, stress can really affect a lot of things and not just your mind.
Mentally and physically, it will lead you to many issues. Stress.
Thank you for that new information. I mean, to me, like. Well, okay. So shall we take a look? Sorry, you wanted to add?
Yeah, one more point.
No problem. Go ahead.
Too many things for me to express. To share.
Yeah, it's passion. You're a passionate physiotherapist.
The next point, Madam Sakina, is actually exercise a proper lifting technique. It's very important. Like what I told you earlier, when you exercise, when you do it properly, lifting technique, when you know the proper lifting technique, you can avoid this back pain thoroughly. I can tell you, because a lot of people get because they don't know the proper way of lifting things from the floor, from the table. They just tend to grab because we were not taught during our young time. So now education is sparse. So everyone can just learn things. So it's very important for you to pick up all this method, implement it yourself, and teach to your friends. And then of course, another prevention is always from individual, where when you have a friend, if your friend doesn't sit properly, tap them from behind. So that will alert them. So this is also another method of educating your very good friends, people around you. Yeah. So this will actually prevent them from getting back pain. At the same time, you also will educate yourself. This can be done, and we are practicing that also. I do practice with friends.
Oh, that's good. That's good. Usually, moms will do that lah to their children.
Actually,
my boss also.
like that.
Whack them one time.
Whack one time.
Yeah, all settled already. Okay, all right. I wanted to say something, but I forgot. What age does do other than back pain? Okay, so there will be some demonstrations. Oh, sorry. Okay, now I remember what I wanted to ask you about lifting things, because of course it's not just dumbbells, free weights, and all that, because people of course have to sometimes carry books lah, and then water especially is very very heavy when you have to angkat the balang, and then what else? Well, if you carry your children, these are things that you cannot avoid, but you have to do. Perhaps, maybe later, if we still have time, you can just explain to us what is the correct way that you described.
I will do it very shortly now.
No problem.
When you have kids, when you have back pain, kids, they're very loving. So they will try to come to you, they play with you.
Yeah.
So that's very wonderful, in human nature. So
Yes.
instead of you pushing them away, don't come close to me, it's better for you to pull the kid, put it next to you on a sofa or a bed, then you hug from the side, rather than you taking the body weight on you and hugging like that. So that is one of the prevention method. You can train the kids to sit next to you, so that will be more obedient and be very wiser for me, if you ask me, especially with back pain. Otherwise, it will increase more, and it's going to cost a lot. So this is for the parents. And lifting things from the floor, make sure you squat down, bend, put one knee down, and then you take the weight of the whatever object you're carrying, your body weight, equally onto your knee. Let the muscle of your lower leg to take that weight, and then push to the spine, align and come up. So by doing this, you will have a very good momentum of the weight into your spine. So this will actually reduce the possibilities for you to get the back pain.
I see. Okay.
Go down, follow the natural way of bending, take and then lift it. You can try this, Madam Shakina. You will see that.
Later after this, I will try. Okay, okay, you've got those the pain control, pain relief, exercises that you're going to show us. Maybe after that, because I know that we fixed the camera so the angle is ideal for you to demonstrate with the model lah. But maybe after that, if you don't mind, you can show us the proper way of lifting something, because this is also very useful because it's preventive, kan?
Yeah, correct. I agree.
We will set that aside for later. Can, no problem. Okay,
So, madam, back to the back pain now. Let me talk about back pain. Again, it's about when a person, he contracted this pain or he already felt the pain at the back.
Okay.
The first thing to evaluate the pain, there is something we call visual analog scale, meaning there is a scale, numerical scale, 1 until 10. So, 0, no pain. 1, mild pain, little bit. And then 2, little bit more pain. 3, 4, 5, moderate pain. And severe pain will be 10. So there is an increase, a very gradual increase in the number. So keeping this in the mind, so the person has to picturize and evaluate what is the scale he is having presently at the moment. So let's say if the person is having 6, perhaps we say it's a moderate pain, 6. So before the treatment, it is 6. So it has to be jotted down. And then after treatment, we'll do a next review. So this will keep in track of the pain scale. So we will know whether this treatment helps or not, or whether pain is increasing every time after treatment. So if the pain increases, then that's when they have to come to the orthopedician, get test done, and then referred for physio. So in physio, what we do as a team, the first most goal is to reduce the pain. Without reducing the pain, it is not going to help any individual at all. So the pain reduction has to be done. So this is what we call pain management. On the orthopedician side, the doctor will actually prescribe some medicines to reduce the pain relief medicines. But on physio side, we have certain gadgets, some miracle gadgets for us to reduce the pain, and it will actually enhance the healing. So we enhance the healing and the pain will go down. So basically this is what. But at the same time, in our own house, every one of us, we have a specific kind of pain relief
connection,
which is in our fridge. It is known as ice.
The
moment we have back pain applied. Can you hear me, madam? So immediately you have
actually there's something wrong with the connection. Your picture was just frozen just now, but okay, it's better now.
Okay, now? Sorry.
Maybe you can repeat the last words that you were saying just now, because the connection was on and off.
Okay, madam. So back home, we all have something as known as ice in the fridge. This ice will actually help to reduce the inflammation when you strain your back. So you must immediately grab this ice, put it at the back at least for 10 to 20 minutes. So you must set a time and then give ice compression to reduce the pain immediately after you injure. But this is not applicable for people who have altered sensation at the back. Certain case patients, they will have altered sensation on the skin. They cannot feel the cold and the thermal. So this type of patients should not try this at home, and I'm advising, please do not try this at home. Okay, rather you can use a spray, cold spray. Nowadays they have heat spray and cold spray. Rather than you doing this ice compression for 10 to 15 minutes, 10 to 20 minutes, it's always advisable you to use a cold spray in this modern era. Just spray it at the back. So when you spray, that chillness will actually help to rejoice the muscle. It will rejuvenate the muscle, and then it will help to heal the muscle rather than it to provoke the pain more. So I'm going to conclude here again. Ice compression is 10 to 20 minutes under observation. Please set your time and do not apply on the skin immediately. Put a cloth and then put it on the cloth. The ice has to be on the cloth, so you don't have a contact with the skin, because prolonged ice can actually lead to burn, frostbite. So to avoid all these things, you have to put a cloth and then only you give compression, and again it has to be given in supervision. Otherwise, it is very dangerous. You will have a wound there. Okay? And I'm not responsible for that.
Okay. Right? This is all, of course, your professional advice. Yeah. Tips.
After the ice, it's actually, if you have a corset, an abdominal binder or a corset, please just wear it. That will help to rest the whole spine, the whole lower back of yours. And this is all just for 3 days. After 3 days, you still have the pain, kindly go and see the doctor.
Okay. Yes, sir. Okay. Okay. All right. I think it's time for us to take a look at the demonstrations. You're going to share with us some tips, right?
Okay, madam. So
okay,
now
I'll let you have the screen.
Yeah. Now, everyone, I'm going to show you some demo on how to relieve back pain at home. And again, I would like to point back. This is specifically for non-specific back pain. If you have PID before, you have some spinal issues, do not attempt to try this at home to relieve your pain. Thank you. Okay. Now I would like to call my colleague Vicky. She will be my model, and with her, I'm going to show you certain things. If I'm not loud enough, kindly tell me, Madam Sakina. I'm shouting here. So I got to have a mask, right?
Good SOP.
All right. Okay. Now I would like to call upon Vicky.
Okay. Hello, Vicky.
Hi.
We pleasure for us to have her here. Actually, she agreed. Come. Okay. So now Vicky is here. Imagine she's having some back pain. So in sitting, there is a way for you to relieve your back pain. But I would personally suggest to do exercises in the bed rather than sitting. But if you think your pain already dropped into number 2, the scale, number 2 or 1, little bit only you feel discomfort, it's fine. You can just do like this also, alright? So the first thing you do is, now Vicky is here. So Vicky gonna grab her leg like this, cross the leg, and she's gonna pull the knee to the opposite side diagonally, and by keeping her spine straight. So this will help to stretch her buttock muscle. Okay. So I have to do this in the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then back to neutral. And she will be doing on the opposite side now.
All right.
Can you see my leg?
I think you need to, that's better. That's better.
All right.
Yeah,
so
thank
now
you.
Pull this towards the opposite shoulder. Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, awesome. So it has to be repeated 5 times on the right side, another 5 on the left side. So this is how you should do. You have to do it very gracefully so that you don't abruptly move your leg up and down.
Yeah.
So that will cause most pain. Now, okay? All right. So next, Vicky going to stretch her sideways, her spine.
Okay.
So for that, she can put the hand on the back and then she's going to go this way, right?
Okay.
It has to be done. The spine has to be well connected,
Right.
straight, and then she has to bend. Similarly, she will count up to 5 or 10. Okay?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Very good.
Sorry, can we take a look from the back? What does it look like from the back? Like, where's the other hand?
Just like
When you do that, okay, all right, just like that.
So that you can align the spine. You're aware of the spine.
Let it
That's
rest.
not better. You can just keep the hand like this in the front and then you just stretch.
Okay. All right.
Okay? There are 2 varieties you can do, and she will repeat on the other side also.
All right.
This side, okay?
1,
2,
2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay.
So we should be repeating these again. The repetition will be 5 times on the right, 5 times on the left. Okay. So everything has to be done in a very graceful manner. Again, it's very graceful, meaning you have to be very slow. Do not pull immediately and do a count and very fast. Okay. So next, Madam Fatina, these are the 2 things you can do in sitting. Now, next I want to teach you, educate all of you, all the viewers. We're going to go in the bed. She has to lie down.
Okay.
So when back pain patient, when they lie down, they have to go sideways first. So we tilt them side and then lift the leg up. This is how you go up to the bed. It is not straight away go at the tampa there. Okay?
Yeah.
Rotate the spine.
All right. Okay, that's clear. Yeah.
Yeah. Okay. Next, Vicky, you need to be in crook line, meaning like this. Okay. And if you see, this is the position you have to maintain. Okay. Maintain this position. We call this as a crook line. And then Vicky, she has to grab her right knee and then pull towards the chest. So when she do this, there are 2 things, Madam Fatina.
Yeah.
Number 1, if any viewers, any one of you having knee pain, kindly don't hug the knee and pull towards the chest. That's going to cause a lot of pain. So instead of that, hold underneath the thigh, under the knee, and then pull towards the chest.
Okay.
So this is how you do. So pull, count 10. 1, 2,
Oh, I see. Okay.
5, 6, 7, 8, 9, 10.
Okay. So another method which I told you is hugging here. If you don't have knee pain, it's fine for you to do this way. But if you have knee pain, those who are elder, please hold at the back.
Okay.
All right. So Vicky has to repeat this on the next leg.
The other side. Okay.
Yeah. The side. And 1, 2. The counting goes
4,
Till 10. Okay.
This is for 5 reps here and 5 reps here. So 10 repetition in total.
Okay. Okay.
Okay?
right?
10.
Right.
Done. Next. Vicky has done the single leg knee to the chest. Next, Vicky, she has to do bilateral or both legs knee to the chest. So she's going to hold at the back of the knee and pull. Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, very good. So this has to be repeated, Madam Sakina, 5 times.
5 times also. All right.
Okay, what we are doing now is basically we are stretching the muscle which has involved. It has strained. The muscle has strained. So there's an injury there. So when we stretch, it will actually promote more good blood circulation to that area and the healing will start off. Okay, and it also increases the fiber. Okay, so that's number 2. Number 3 is knee together, both knees together. And we're going to do spine rotation, meaning we're going to slowly stretch the spine now. Just now we stretched the buttock. Now this is the spine. This is the area.
Okay.
Okay, so this has to be done very gracefully again
Yeah.
to avoid further injury. Okay, so slowly, and there you go. So count 10. 1, 2,
3, 4, 5, 6, 7, 8, 9, 10.
Awesome. Then gracefully to the neutral position and to the right side. And when Vicky does this, automatically she turns to the opposite side. So that she will have more stretch.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Awesome. So this has to be repeated for 10 times, Madam Shakina. Viewers, we do this 10 times in a very graceful manner so that to avoid any unwanted pain. Next will be pelvic tilt, where use your thumb and use your index finger. Put it up. Can you see Vicky? Feel the pelvic tilt. So once you feel the pelvic bone, lock it. Stabilize it with your hand. Now gradually you can see Vicky will lift up, she will tilt her pelvic and then she will drop it down. So we call this anterior tilt of pelvic and posterior tilt of pelvic. So this has to be done slowly again, do not do very fast. So repetition will be 10.
Just a slight lift.
Yeah.
Very slight lift, front and back, that's it. So you feel good mobility around that area. Okay.
I see.
1.
Also 10 times?
2.
Also 10 times.
Okay.
3, 4,
4, 5.
Oh, I see.
7.
Okay.
8, 9, 10. Awesome.
Got it.
Okay.
All right.
This is the pelvic tilt, and the last one for today is actually pelvic bridging. Remove the pillow. Vicky has to lift the butt up slowly. So it has to be done in 3 tempos, meaning 1, 2, 3. Just 3, 2, 1. Do not do 1, 2, 2, 1. 1, 2, 2, 1.
Okay.
Come up slowly. Lift the butt up. 1, 2, 3. That's the max. And then you're going to go down now. 3, 2.
Oh, I see.
So she's resting the pelvic in a very graceful manner. Okay? All right. Again. So you got to do this 10 times also, Madam Shaki. Now, viewers.
1, 2,
3. So the more she does, then you go higher and higher. And down.
3, 2, 1.
How long do you hold the tummy for when it's in that position?
First attempt. So later only there will be a progression.
Okay.
It's just movement. We want the permeability of the movement to come back.
I see. Okay. All right.
Okay. So you got to do this 10 times. All right. And next. So when you have back pain, you tend to have you will have limitation of movement, as I told you. So to avoid that, you have to do a proper sleeping positioning where the head, put a pillow over the head. Next, get one extra pillow. Put it under the knee. Put it under the knee. So this will actually help to ease the back. Other than that, it is to stretch the back. Okay. Try this at home. When you practice this, you will have a good, relaxed spine, especially at the back.
Okay.
So it breaks it. Okay. And then when you go to the side line, remove, put a pillow in between the thigh, and then turn. This is how you sleep. Okay. So you need support of a pillow underneath, between your thigh.
All right.
So this is the back pain. So these are the things you can do at home.
Yeah.
Okay. Then slowly turn.
Okay.
All right. So these are the exercises which I wanted to teach you all, wanted to share with you all actually. Okay.
Thank you very much. That was informative and very clear. Yeah.
Vicky got to go to the side of her, fist the hand, press the hand, and she will get up.
Oh, the correct way to come up after you lie down.
Viewers and Madam Sakina, please implement this from this second. The moment tonight you go to the bed, make sure you lie down like this. You show again, okay?
Okay.
Lie down.
Oh, I see.
Yeah.
Okay, usually I just dive.
Okay, next. Side way again to get up. Yeah, fist the hand, give a push there. Sir?
It looks very good.
Correct.
Okay, thank you very much, Vicky. Seka, just now you were saying that maybe, belum. We've got some questions actually.
Yes, madam.
We've got some questions from our viewers. Maybe we'll just start answering the questions. Before that, so many people are saying hi to you.
Hi, everyone.
Lara, Vanita, Barjesh, Aichin. Okay. And then, this is the question by Ms. Sudha Menon. Hi, my mom has degenerative disc disease. What exercises are suitable?
Okay. So, hi, Madam Sudha. Sudha Menon, nice to meet you. And Madam, actually, as I told you earlier, the topic today what we're discussing is unspecific back pain. So, what your mom is having is actually something else beyond what we're supposed to talk today. So, Madam, actually, degenerative disc disease, you must go and consult a physiotherapy in person. Let the therapist see your mother, let him assess your mother, then he will give you a proper exercise regime. Otherwise, it's very difficult for me to explain here. I cannot see mom. I cannot see my client. It's difficult for me. So whatever I can say is very generalized.
Okay. All right. So we'll take the next question from Mr. Bardi Paul. What is the best exercise and tips for lower back pain for a regular office person with sitting job? I think a lot of people can relate to this.
Exactly. That's why they have that question.
Yeah.
That's good, sir. Budget Paul. Yeah. So what you can do in the office actually before you start your duty, you must do a proper stretching exercises, which you can see there are certain exercises is already been done in a video form by my colleague, very best friend of mine, Miss Aziz. Aziz has done a chair exercise for those who are desk-bound people, who are those working in office. They've already edited and then they are already published it in our Colombia, Asia, Malaysia Facebook. You can go a little bit further and then you can flip, you can see. You can actually practice that because it's very safe for you to do. So stretch and then you can do that exercise so that you get a good core while doing work. So it's 2 in 1, no? You can utilize that. And there are a few more videos to come also, don't worry. You just be with our Facebook, you will see a lot of things. It can change your life.
Yeah. That's very true. Yeah, we plan to have a lot more very useful information, useful talks so that we can demonstrate because it's a video, you all can see how exactly it's done.
Exactly.
Yeah, so,
it's a very good time. I like it.
Thank you. Okay, we've got another one here from Miss Mailka How. My left knee felt pain when going up and down the stairs. How to reduce the pain? Oh, no, we're talking about knee pain. Maybe, just a quick one from you.
Okay, Ken. Mailka, actually, my topic today is to discuss about back pain. Your question is more to the knee pain. Do permit me, Madam Shakina, for me to just say.
Yeah.
Okay, that's good. So, Mailka, actually, what you can do is actually you must go and meet an orthopedician or a physiotherapist. You check your knee because your age factor, your daily activities, all this matters to the knee. So just immediately prescribe through a live Facebook, I cannot, because exercises is very individual and certain exercises are not allowed to be done by certain conditions. So it has to be in person, then only the therapist can give you and teach you in a proper way. This is the proper channel which I can open to you and you get it done. So you're always welcome. You can come over to Setapak. We'll give you the best.
Okay. All right. There's another one from Mr. Saravanan Krishnan. How effective is the physiotherapy treatment to relieve back pain?
how effective. Mr. Saran, hi Mr. Saran. Hope you're doing good. Physiotherapy and back pain. That is basically our client. Back pain is our client. So those with back pain, it is very effective, as I told you earlier, madam and viewers. Very effective if it is unspecific back pain, like how I told you, it's just a sore, muscle sore. But if it falls under the conditional spinal condition issues, then that is totally a different chapter which I have to open up in a different manner. But the effectiveness is always within 3 to 4 days. Normally, within 6 sessions, patient will get rid of the pain. They will always have little bit of discomfort. That's for sure. I can say. The pain will go off somehow.
Okay, all right. So with discipline and following instructions are your specific instructions, of course.
Yes, madam. The thing is, they have to come to us so that we can teach them and then do the best for them.
Yeah, of course. Yeah, you will need to see them face to face lah to assess better, right? Okay. Miss Izzah Azman is asking, are these exercises suitable to those with slip disc?
Oh, Madam Azza, Miss Izzah, actually, these exercises, whatever I say, I've already mentioned in the video earlier that it is not suitable for spinal condition. Again, when I say spinal condition, it is anything related to the spine and then issue in that structure. But what I'm doing today is basically I'm treating your muscle alone. So it's about muscle and that is spine. So whatever exercises I'm teaching, you might have this component in your physiotherapy, but it will be more focused into something else when you meet the physiotherapist. So today, basically for the muscle to be stretched and then let that circulation to take place and then heal the muscle. That's the whole idea of today.
Okay. Maybe we can have just for Puan Izzah's consumption, maybe we could do a whole topic about slip disc and how to manage that, because that's also something that's very common and a lot of people are suffering from that. Okay, Mrs. Chong. Okay, we can take this as one last question. Mrs. Celia Chong is asking, is sleeping on the floor good or bad for my back?
Okay, Mrs. Celia, sleeping on the floor is good or bad? Okay. Again, it's a very generalized question. I haven't seen you in person. I don't know how good is your spine structure. I don't know how good is your muscle structure. So,
generally.
In general, I would say it's always good for you to have a good firm mattress and not sleep in the mattress rather than you sleeping on a bare floor. Because bare floor, you don't have a good support. So it doesn't absorb the body weight. So when you have a good mattress, a very firm mattress, somehow the body weight will be distributed evenly within the foam. So this also plays a very important role. But Celia, as I told you, the last thing which I showed, you can implement in you. You can put a pillow in between and put another pillow under the knee. So you have to do this. Then this will also help to reduce your pain. So sleeping on the floor is individual. Going on a mattress to sleep is still individual. I cannot comment much.
Okay, understand. Okay, all right. That was very enlightening. Okay, because we mentioned just now about doing this very last thing before we go off air. That demonstration about how to carry something heavy. If you don't mind, very quickly.
Correct. Okay.
Yeah, so, the position so that you don't hurt your back. Generally.
All right. So,
berat.
Very importantly, when you do weightlifting, you must be aware what's the kilo like. If it's more than your capacity, because every one of us, very individually, we have a different capacity of weight which we can carry. So, according to your weight, if you think you cannot carry in the first place, please call your friend, anyone near you, to lift together. That's number one.
Okay.
Number two, if you think you're a Hercules, you can just carry, go ahead. But you do it in a proper way. Like, like the first thing, I got to adjust the angle.
Can, no problem, yeah. Because this is very useful.
I'm going to go on the, don't try this at home, okay? I don't know the option. I have to go on the beat.
This is so funny, but it's very useful. Okay, there you go.
So I'm standing straight, and I'm going to bend my knee.
Okay.
Bend it this way.
Oh.
So basically, I'm kneeling. Okay, and imagine this is the object which I'm going to carry. Okay.
Right.
So I kneel, and then I'm going to carry. So I bend. I don't bend like this. No. Keep it straight. Then closer to the spine. So you hug,
Yeah.
and then lift the body weight to the spine, and then you go up. So what happens here? I am taking the whole body weight into my legs.
I see. Okay.
Okay, so I'm using my lower body to take the body weight. The body weight and the external weight, additional weight into my stomach. Okay, so when I do this, I have to contract my abdomen.
Yeah.
Abdomen has to be contracted, pull the abdomen, draw the abdomen towards the spine. So when you draw the abdomen towards the spine, you will have a good pull there. So it's very hard. But if you don't do that, it's gonna sag. You're gonna take the weight, and the shifting of the weight going to be improper.
I see.
So that's when the problem starts. So rather than start the problem, you better correct properly, pull it, draw it in, and then hug the object, and then push. Use your leg, push down, and carry down.
Okay.
And you will have a good base. So when you have, then the distribution will be perfect. You will never get. And then where you want to put this, you have to plan earlier. So for that, you have to carry and put at the level of your shoulder level, maybe pelvic level. It's all up to you. Maybe you want to put somewhere else. It's all same. So if you're going to shift, take the thing and then put it on a different place. Similarly, put the thing and then bend, go down, and put back. So the spine has to be straight. Do not bend down. Do not bend the spine. Keep it straight, and then you put the object down. So
only reverse. Okay. Thank you. That was very, very useful. The past hour has been excellent with your tips and advice. Mr. Chandrasegar Gobi from Columbia Asia Hospital, Setapak. He's a physiotherapist who has kindly shared with us everything about handling pain that you feel in the back, and also about how you should take care of your posture and how to lift things the correct way. So with that, I would like to say farewell for today, because we'll see you all again next week with more exciting topics about health. Okay, thank you, Segar, and thank you everyone.
Glad to know you, and I really had a good time with you.
Wait. There's actually 2 more questions. Can we?
Yes, you may.
Okay. Yes, will helpful. Can you explain something? Okay, I think we've done this already. About posture, because we've run out of time also, but I just wanted to see the question. Okay, if you have any more questions, because we cannot stay on air, what we can do is we can always get back to you. Just leave your questions. Continue doing that. We'll get back to you. Okay, all right. Well, thank you so much. Bye.